In other news now, we hear a lot about so-called medical breakthroughs that never seem to live up to their promise or just fade from public attention. But tonight we have something different for you.
And very promising. What if breast cancer could be diagnosed with the prick of a finger? That's what McGill researchers are working on.
And early results are very encouraging. With details, here's our health specialist, Beatrice Politi.
Doctors have been testing blood for years, looking for signs of health and disease. But this isn't your average blood test. This test can tell you if you have breast cancer.
What we are developing is novel technologies to measure proteins in the blood, and what we found is a fingerprint for cancer in the blood.
McGill researchers measured the profile of 32 proteins in the blood of 17 people with estrogen receptor positive breast cancer and 11 people without cancer.
So these are 6 proteins that are normally found in the blood as well, and what we're seeing is changes in concentration in the blood. And so for some of them it increases, for some of them it decreases, and it's actually by looking at the combination of the 6 proteins for breast cancer patients and for controls that we can then establish significant differences for each of them.
The test in the small sample was 100% accurate at detecting who already had cancer and who didn't.
We are trying to characterize the patterns here.
And now new research at the University of Calgary may help detect that cancer months before a lump or tumor forms.
This is the normal tissue pattern.
Researchers looked at mammograms of those later diagnosed with breast cancer and found abnormal tissue patterns back then were a warning sign of cancer to come.
We are detecting this sign 15 months earlier than the cancer is detected or diagnosed.
University of Calgary researchers looked at 106 images. Much larger samples are needed to verify their findings before their work would be used for screening purposes.
McGill researchers also need to do more studies replicating their findings with a much larger sample size and with patients with other types of breast cancer to see if the test is as accurate in those cases.
So exciting, though.
It is exciting, isn't it? Imagine being able to get the blood test instead of a mammogram, or the blood test telling you at your annual physical.
Unbelievable. All right. Thank you, B.
You're welcome.